TergoGlide. User's instructions. TergoGlide. Application. The TergoGlide is a technical aid used for transferring, lifting and repositioning patients. The TergoGlide may be used to lift patients weighing a maximum of 200 kilos. TergoGlide contains an integrated absorbent incontinence pad. The TergoGlide reduces tissue stretch and minimizes the risk for pressure sores for patients being repositioned. TergoGlide is always available, reducing the nurse's working time. TergoGlide makes it easier for caregivers to work alone. TergoGlide reduces substantially occupational injuries, musculoskeletal disorders, and the costs of care. TergoGlide. Structure. The upper surface of the TergoGlide is composed of an absorbent incontinence pad. There are 6 strong handles on both sides of the TergoGlide. The TergoGlide glides excellently from side to side of the bed. The TergoGlide will not slide down the bed. Standard sizes are 88 by 120 and 105 by 120 centimeters. TergoGlide. Safe and robust technical aid. The TergoGlide is a Class 1 medical device according to the European Medical Device Directive, and it complies with the international ISO patient lifting standard. When laundered according to instructions, the TergoGlide will have an endurance of at least 100 washings. The TergoGlide is safe and comfortable for the patient. The TergoGlide is a unique innovation developed by the Caritol Group. TergoGlide. Right position under the patient. The TergoGlide is correctly placed under the patient when it reaches slightly above the shoulders. The pillow must be under the neck, on the surface of the TergoGlide. The TergoGlide protects the bed and is immediately available for patient transfers and repositioning. TergoGlide, height of the bed. The height of the bed is adjusted according to the height of the nurse. When her arms are alongside the body, the level of the nurse's knuckles reach the level of the mattress surface. If several nurses are involved, the bed height is adjusted according to the shortest of the nurses. TergoGlide, basic principles of the patient transfer. Starting position is walking position, knees flexed, one foot slightly in front of the other. Keep elbows tightly locked to the sides. Take hold of the handles with a reverse grip. Keep back straight, knees slightly flexed. Move the patient by moving your own weight. Always urge the patient to participate in the transfer if possible. Reposition the patient by moving one body part at a time. No hurry. Keep your movements smooth and coordinated. TergoGlide. Repositioning the patient face toward yourself. Correct starting position. Keep your back straight. Keep your elbows tightly locked to the sides. Place the TergoGlide correctly under the patient. Move the patient by moving your own weight. Flex the outer leg of the patient. Turn the patient's head toward yourself. Take a hold of the handles. Turn the patient one body part at a time. Repositioning the patient face away from yourself. Again, the starting position. The opposite side rail of the bed must be up. Move the patient toward yourself with the help of your own weight. Flex the leg of the patient which is closer to yourself. Turn the patient's face away from yourself. Take a hold of the handles, turn the patient one body part at a time. TergoGlide. Moving the patient upwards in bed. Correct starting position. The nurse positions one foot at the level of the patient's shoulder, the other foot gives support from behind. Take a hold of the handles closest to the patient's shoulders and hip. Lift the patient upwards with the help of your own weight. TergoGlide. Assisting the patient to sit up in bed. Stand straight beside the bed, facing the patient. Turn the patient toward yourself. Slide gently the patient's legs over the edge of the bed. Take a firm hold of the patient with your one arm under the shoulders and take a hold of the TergoGlide handle with the other hand. Assist the patient to a sitting position, then lower the bed. TergoGlide. Lifting the patient from the floor. There is no hurry to lift up a patient who has fallen out of bed. If a patient lifter is not available, a manual lifting procedure is an alternative. The TergoGlide may be used to lift patients weighing a maximum of 200 kilos. Place a pillow under the patient's head and then slide the TergoGlide under the patient with log roll technique. During lifting, keep your back as straight as possible. Start lifting on the count of 3 and place the patient in the bed. TergoGlide. Replacing soiled TergoGlide. The caregiver changing a soiled TergoGlide starts by turning the patient's face toward himself. The soiled TergoGlide sticks to the patient's back. A clean TergoGlide is placed against the soiled one, the gliding surfaces against each other. The clean TergoGlide is rolled inside the soiled one. About half of the width of the clean TergoGlide is on the bed with the incontinence pad upwards. The patient is turned onto the clean half of the TergoGlide. The soiled TergoGlide is removed, the patient is positioned on her back and the TergoGlide is straightened.